It's important that we match your patient identification before we undertake any task or go through any procedure whilst you're within our care.
Speak with our patients, we check with them virtually every time we do something with them, just to
Identify
make
them
sure.
against their armbands, identify against the chart, and have their names clearly identified on the board.
So some examples are when you are welcome to the ward and we undertake your admission, we'll thoroughly go through your identification at that time. We'll check the spelling of your name, we'll check your date of birth, we'll check your address, we'll check your next of kin, we'll check your GP details.
Allergies are a really important thing within hospitals.
Yeah.
We're all about not causing harm to people, and a medication error with an allergy can kill somebody. So
We always ensure that you have an accurate armband on as well, and that guides the nursing staff whenever they're doing interventions or cares for you. This may include medication administration, and the nursing staff will always again ask you at that point for your name and your date of birth, and we again check your UR number. They're the three sources of identification that we use. Needing to obtain samples, so we might ask for a urine specimen or need to obtain a blood test from you, and that's another example. We'll make sure that we accurately obtain your patient identification details for safety. So I've mentioned a couple of examples, and that's with our medication administration and then also on admission to the ward. Also when we're doing clinical handover to our colleagues, so when we're handing over patients, we'll also check at that point the ID band. We'll have a little look at the board above their head to ensure that we're addressing the right patient at that point. So clinical handover is another significant time. We might be handing over to our colleagues on another ward, or we might be discussing details between our fellow health clinicians in other facilities. And it's still very much important that we have that correct patient identification for safety. Make sure that our patient's armband is in situ, that it's clear and legible, and that when we're doing any task or any involvement of care, that we address their name, their date of birth and their UR number for safety. That's always checking, yes. We see up to 900 patients a month on our ward here in the medical assessment unit, so we have a very high turnover. But patient identification is one of the primary focuses for us to maintain safety within our ward and maintain safety within the delivery of care we have for our patients.